Hi there! In this video we're going to be demonstrating abdominal massage during pregnancy. This is completely safe to do at most stages of your pregnancy. I started doing this around 15 weeks whenever I felt some tension throughout my abdomen, and here I am at 36 weeks still doing it nightly. So completely safe to do for you and for baby. There's a lot of tissue and fluid in here, so this is not going to hurt baby at all. They might feel some changes in positioning and respond to that with movement, but it's completely and 100% safe for baby. So what we're going to be focusing on is releasing the round ligaments, which are the ligaments that attach from the front of the pelvis to the sides of the uterus. We're also going to be focusing on releasing the obliques here, which can get really, really tight as the uterus expands. And we're also going to be releasing any tissue under the rib cage. We want the tissue of our abdomen to be very supple and healthy because that allows our baby to move freely, to position themselves. So to get down onto the floor or the bed here, what you're going to do is come onto the side here and roll over to your back. You can keep your knees bent because that helps to relax the tissue of your abdomen. We're going to be starting at the right side of the round ligament here. So you'll want to start in between your pubic joint and your hip joint here, right in the middle. And you can get in there and just do some gentle circles. I'm getting in here about 1 inch or 2. It's pretty deep, but again, completely safe for baby. And wherever you have tension, you might feel a little bit of discomfort, but it should be discomfort like you're releasing something and not sharp pain. So I'm just doing some gentle circles, going up through my obliques here on the right side. You want to start at the right side of your abdomen and go up. And this is where baby is positioned. She's on my right side right now. So I don't have a ton of room to get in there to release, but I'm just kind of following her body and moving up through the rib cage. As I move into the left side, I'm skipping this midline portion of my abdomen. And that's because this is where the separation is occurring. So this tissue here is very fragile. We don't want to put much stress or strain there. So we're moving from the right side of the rib cage just to the left here, getting up under the rib cage, releasing that tissue there, moving down on the left side of the obliques. And these are pretty tight on me. So I'm going to be spending a little extra time here to release that. And then again, moving down to the left side of the round ligament here. So just to recap, we're starting at the right side of the round ligament, going up the right side of the obliques under the rib cage, skipping the midline portion here, coming from the left rib cage down the obliques to the left side of the round ligament. And you can do that, a couple passes through that. It'll really make a big difference after a long day. One thing you can also do is if you are noticing some tension in the midline and in the center of your abdomen here, you can get 1 inch or 2 in from the midline and just work that rectus abdominis muscle here. You can still release it, but I don't want you doing it across the belly button and through the midline because again, that tissue is very tender and fragile as the separation, that diastasis occurs, which is 100% normal and healthy after 35 weeks of pregnancy anyways. Okay, and to get up out of this position, you'll want to roll over onto the side and push yourself up. So thanks for watching.